So this is a technique for neuromuscular reeducation to help the serratus anterior to get elevation with upward rotation. Often patients with thoracic outlet and other shoulder issues need a little help kicking in their serratus. So what we're going to do, I'm going to have him in a sideline position. I've got a pillow between his knees to stabilize his pelvis because I don't want any cheating of his trunk. He keeps his arm completely relaxed. So we can first stretch into the range that we're trying to gain. So we think about with shoulder elevation, the scapula elevates and upwardly rotates. So I'm going to place my hand right along the medial scapular border and inferior angle, coming up, and I'm going to first just stretch because it happens, a lot of people have limits just passively getting here. So we want to open the road first and do a little stretching here. And when you get appropriate elevation, you're taking pressure off the brachial plexus so they won't have symptoms in their arm. And then once you've got some passive mobility, now I'm going to have you help me. You're going to ask your patient to lead with their armpit because we want the scapula leading, not their arm. A lot of times they compensate with deltoid motion. Relax for me. So your arm's going to stay relaxed. Your armpit faces one hip. Then when we're done, it's facing up here. So we're going to come up and around and relax. Keep this arm relaxed. So I'm guiding the scapula into elevation with upward rotation, kicking in the serratus anterior in a shortened range where it's going to facilitate overhead motion. I can do this active assistively. Here, hold that. He can do a place and hold and come on back. We can then add a little bit of resistance. So the resistance is going to be along the lateral border first. Hold that for me. Good, and let go a little. Okay, again, come on up and hold. Good, and let go a little. And pretty good. What you'll see often is if they're weaker, kind of a ratchety motion when they come back eccentrically. Then we can advance further to giving some input at the proximal humerus. So come on up here. Okay, good, and I want you to hold that. Don't let me move you. Ready? Hold. And you can do some rhythmic stabilization here to further challenge that serratus. Good, and slowly let go. Good, and one more time. Come on up. This is fabulous for your TOS patient, for your patient with shoulder impingement that you're trying to get more serratus recruitment, as well as your frozen shoulder. Relax slowly. Perfect.